Hi guys, this is Dr. Sitaram Raju, and today we'll be talking about menstrual cycle. Coming to menstrual cycle, what is menstrual cycle? Menstrual cycle is the cyclical changes that occur in uterus, ovary, cervix and vagina in a reproductive woman during her reproductive life. So it starts from menarche, that's the onset of menstruation, and ends at menopause. And usually a menstrual cycle duration is around 28 days, can be in between 18 to 40 days, and we consider day 1 as the first day of bleeding. So coming to the ovarian cycle, these 28 days are divided into, the first 13 days is divided into follicular phase, so development of a Graafian follicle. Then it is released on 14th day, it is called ovulation phase. Then it forms corpus luteum, that is called as luteal phase, which extends from 15 to 28 days. So here you can see from the primordial follicle to the ovulation, it is called as follicular phase, and the release of ovum is called as ovulation. After the release of ovum, the remaining Graafian follicle will become corpus luteum. Corpus luteum, based on whether the pregnancy occurred or not, if pregnancy doesn't occur, it degenerates. If pregnancy occurs, it remains for 3 more months for maintenance of the pregnancy. And coming to the folliculogenesis, usually at birth there will be 7 million follicles, and at birth it becomes 2 millions. So in fetus around 7 millions, and at birth 2 millions. And out of this, only 1 million undergoes the first meiotic division, and they are arrested in prophase 1. So prophase 1 arrest will be there. After that, during puberty, there will be only 3 lakhs of follicles remained, and out of this only 450 follicles will be released, remaining all will undergo atresia. So the phases of folliculogenesis, the first one is primordial, and the next one is primary, secondary, tertiary and Graafian follicle. From this Graafian follicle we'll get the ovum, which we call that as ovulation. So what are these phases? So primordial follicle is nothing but a oocyte surrounded by flat granular cells. So it is a diploid primary oocyte around 10 microns in size, and it is surrounded by flattened granular cells, and they are incompletely covered, and there is a basal lamina. Now it converts into primary follicle. So the primary follicle, here the granulosa cells becomes cuboidal, that means flattened will become cuboidal, and they are completely lining the oocyte, and the oocyte increases to 20 microns, and there occurs a layer called as zona pellucida, which occupies the space between granulosa cells and oocyte. After the primary follicle, it develops into a secondary follicle, which is also called as preantral follicle. Here the granulosa cells becomes multi-layered. There are multi-layered granular cells, and you see the oocyte has become almost 100 microns, and there is development of theca interna and theca externa. Theca externa becomes the capsular wall, and this theca interna will secrete hormones. Now it modifies into the next stage called as tertiary follicle or antral follicle. Antrum is the space. So the space that is developed in the follicle is called as antrum. So here the granular cells still starts proliferating, and there appears follicular cavity, and this cavity is filled with a substance called as liquor folliculi, which is rich in estrogen, and the oocyte is pushed to the periphery, and surrounding granulosa cells around this oocyte are called as cumulus oophorus, and those cells which are attaching to the oocyte are called as corona radiata, and now the oocyte has developed into a size of 150 microns. Now the final stage of development of follicle is Graafian follicle. Here if you see, it is around 2 to 5 mm, the oocyte becomes 2 to 5 mm, and the cavity becomes larger, and we call that as antrum. It becomes larger, and the theca interna becomes prominent. Theca interna becomes prominent, and just before ovulation it completes its meiotic one division, that is, it is arrested in prophase, it just completes it, and it forms secondary oocyte, which is a haploid and first polar body. Still it has not completed its meiosis 2. Meiosis 1 is completed and it produced first polar body. And these granular cells are called as cumulus oophorus, and the cells around the oocyte are called as corona radiata. Now the Graafian follicle at 14th day is ovulated, and the reason for the ovulation is sudden increase of luteinizing hormone just 24 hours prior to ovulation. So what is happening here is there is two mechanisms. One, increase in prostaglandin E2 and F2. Another one is activation of plasminogen activator. This plasminogen activator will activate plasmin, which has a fibrinolytic activity, and it breaks the follicular wall. So it breaks the follicular wall. And this prostaglandin E2 is the vasodilator, and it increases the blood flow, which increases the follicular fluid, so that the pressure in the antrum increases and pushes the oocyte to the periphery, and it appears on the wall of the ovary as a stigma. And prostaglandin F2 alpha is primarily concerned with the activation of lysosomes, which again causes proteolysis and digestion of follicular waste. All these factors favors the rupture of the follicle and release of ovum, and the primary reason for this is LH surge. So this is what stigma, this is what the protruding oocyte. And what are the indicators of ovulation? So one, rise in basal body temperature, around 0.3 to 0.5 degrees centigrade rise in the basal body temperature, and estimation of urine hormonal components like estrone at ovulation and pregnenolone after ovulation, their content increases, or determination of plasma hormonal levels, estrogen and luteinizing hormone just prior to ovulation increases, and FSH decreases just before ovulation, and progesterone's levels increases after ovulation, and there might be a lower abdomen pain during mid-cycle, that is called as Mittel's merge, which is due to the release of ovum, and serial ultrasonography can reveal the follicular development and empty follicle, and firm pattern will be seen in the cervical mucosa when it was estrogen dominant. Once the estrogen level falls, that means ovum is released, cervical mucous pattern loses its firm pattern. Next, after the ovulation, from 15th to 28th day, we call that as luteal phase. Here, the theca cells and the granular cells undergo luteinization, and now they are more sensitive to luteinizing hormone, and accumulation of lipid droplets in those cells occurs. Now these lutein cells will secrete progesterone and estrogen. After the ovulation, the empty Graafian follicle will be filled with blood, and we call that as corpus hemorrhagicum, and which slowly converts into corpus luteum under the influence of luteinizing hormone. And if at all fertilization occurs, the syncytiotrophoblasts will maintain the corpus luteum by secreting HCG, because LH is inhibited by circulating estrogen as well as progesterone. So no more LH once the luteal phase is about to over. If at all fertilization occurs, the syncytial trophoblast will secrete HCG and that will continue the corpus luteum for 3 months. After that, placenta will come into the action and it will secrete progesterone. If no fertilization occurs, so there is no HCG as well as no LH, so corpus luteum degenerates into corpus albicans. Now coming to the uterine cycle. Uterine cycle is divided into 3 phases. 1. Menstrual phase, that is bleeding. 2. Proliferative phase, that is division of the endometrium, and secretory phase, that is more development of the glands. So 1 to 5 days is called as menstrual phase, 6 to 14th day is called as proliferative phase, and 15 to 28th day is called as secretory phase. Why menstrual phase occurs? Why bleeding occurs? It's simple. It's an involution of the endometrium because estrogen and progesterone are reduced because the FSH and LH are reduced. This causes, as they are potent vasodilators, now vasoconstriction occurs, which causes hypoxia and necrosis to the stratum functional layer, and this causes rupture of blood vessels and bleeding. Now around 35 ml of menstrual bleed along with the 35 ml of serous fluid is the routine menstrual bleeding, and the bleed contains one blood as well as desquamated epithelium. As the blood clots, it is lysed immediately by fibrinolysin so that it can easily flow out of the uterine cavity. And now the thickness of the endometrium is around 1 mm after the menstrual phase. Now comes the proliferative phase. So whatever that is lost, now we are getting back our estrogen. This estrogen will cause proliferation of endometrial cells, development of glands, development of new blood vessels, that is called angiogenesis, and as the proliferation occurs, now the thickness increases to 4 mm. So 3 to 4 mm. This primarily under the influence of estrogen. Coming to the secretory phase, it is from 15th to 28th day. Now secretory, somewhat concerned with the glands, so the glands become tortuous and the blood vessels become dilated and thickness increases to 6 mm, and it is dependent on both estrogen as well as progesterone. And coming to the cervical changes, primarily the mucus. Cervical mucus become thin and alkaline during proliferative phase, that is primarily under the influence of estrogen. And stretching of the cervical mucosa is called a Spin-Barkett test. If at all that mucus is stretched onto the slide and allowed to dry, it forms a fern pattern due to more sodium chloride in that. That is called fern pattern. So estrogen will cause Spin-Barkett test and fern pattern. And in secretory phase, this mucus will become thick and this fern pattern will be lost. Coming to the vaginal changes, the epithelium becomes cornified during proliferative phase, that is under the influence of estrogen, and leukocytic infiltration as well as epithelial proliferation in secretory phase. Now coming to the hormonal regulation of menstrual cycle, we have to primarily know that hypothalamo-pituitary-ovarian axis. So first of all, hypothalamus is the one which secretes GnRH, and it won't secrete it continuously, it secretes it in pulsatile manner. And this acts over the anterior pituitary. Anterior pituitary will secrete gonadotropins like follicular stimulating hormone and luteinizing hormone, which acts on the ovary to produce estrogen and progesterone. These estrogen and progesterone will act over uterus. And there are two feedback mechanisms here. Most of the cycle, estrogen will and progesterone will inhibit either pituitary or hypothalamus to stop GnRH and FSH and LH. But exactly prior to the ovulation, this increased levels of estrogen will cause paradoxically a positive feedback mechanism that is only before the ovulation. So coming to the only ovarian changes. So follicular phase. So the name itself it's saying follicular phase. So primarily dependent on FSH. Okay, we'll see that. So GnRH will be secreted pulsatilely for every 24 hours and the GnRH will cause the release of FSH and LH. Now FSH will act over the granulosa cells to produce estrogen and LH acts over theca cells to produce androgens. This estrogen which is produced from the granulosa cells will further help in the growth of the follicle. So the dominant follicle is the one which is having more number of FSH receptors. More the number of FSH receptors, more will be the estrogen, more will be the growth of the follicle. So the dominant follicle is recruited in that way. Okay, early follicular phase, what is happening is GnRH, FSH, LH. This LH will act over theca cells and these theca cells will produce androgens. FSH will act over granulosa cells. Granulosa cells contain an enzyme aromatase which converts these androgens into estrogens. In mid follicular phase, here this FSH is acting over the follicular cell, granulosa cells which secrete a hormone inhibin which inhibits the FSH secretion. So FSH is inhibiting itself by using an hormone inhibin. In the late follicular phase, but just before the ovulation, this LH also causes activation of granular cells. Prior to that, LH has only receptors over theca cells. But during just before the ovulation, granulosa cells also will have LH receptors. Now, that causes high levels of estrogen, which favors the furthermore release of LH, which causes the ovulation. So there is a double feedback mechanism. Estrogen at moderate levels will cause negative feedback mechanism. Estrogen at higher levels, positive feedback mechanism. And this causes the activation of more receptors on the granulosa cells, FSH as well as LH receptors. So furthermore, so more the receptors, more the growth of the Graafian follicle. And LH also stimulates the secretion of estrogen as because androgens are produced from theca cells which are converted into estrogens by an enzyme aromatase which is located in the granulosa cells. And LH also acts on the theca cells to produce progesterone. While in the luteal phase, these theca cells produce progesterone and paradoxically it inhibits this aromatase ovulation. So LH surge which occurs just 24 hours and this positive feedback of rise of LH is due to rise in estrogen. So just prior to the ovulation there will be rise of estrogen which causes LH surge. Coming to the luteal phase, mainly under the control of luteinizing hormone which converts the granulosa cells into lutein cells and secretion of estrogen and progesterone starts, and this luteinizing hormone is the one which maintains corpus luteum. And FSH also maintains the secretory activity of corpus luteum, and also as we said it also stimulates the lutein cells to secrete inhibin. So in the luteal phase, the primary one is luteinizing hormone which acts over the corpus luteum to primarily secrete progesterone, as well as FSH acts acts on the corpus luteum primarily for the secretion of estrogen. These act over the uterus. So progesterone, which is estrogen, creates a negative feedback, and inhibin also inhibits the GnRH, FSH and LH. And as there is no luteinizing hormone, corpus luteum starts degenerating. So if corpus luteum is not there, no estrogen and progesterone. So no estrogen and progesterone means endometrium sheds. Endometrium sheds, and again GnRH starts its production, and which activates FSH, LH, and the next cycle repeats. So coming to the uterine changes, one is proliferative phase, another one is secretory, and menstrual. So menstrual phase, we already know, no estrogen, no progesterone, vasoconstriction, death of the tissue. That causes bleeding. And proliferative phase is primarily under the control of estrogen, and secretory phase is primarily under the control of progesterone as well as estrogen. So to summarize, first, GnRH is secreted from hypothalamus, which acts over the anterior pituitary to produce FSH and LH. This FSH will cause the growth of follicle, and this LH surge will cause ovulation, and this luteinizing hormone maintains this corpus luteum. And just before the ovulation, the levels of estrogen increases, which causes the LH surge. If estrogen is there, that causes proliferative phase. If progesterone is there, that causes secretory phase. So in proliferative phase, there is division of cells as well as angiogenesis, as well as glands. In secretory phase, you can see glands become tortuous, blood vessels become tortuous. Once estrogen and progesterone are stopped, here you can see there is bleeding. That's the menstrual phase. I think I'm clear. I think hope you understand it well. Thank you. Bye.